Guys, welcome back to Medical Coding with Blue. Today's episode is all about the do's and don'ts of interviewing for medical billing or medical coding positions. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So, first things first, these tips are universal for biller positions or coder positions. I have done many videos on how to interview for a medical coder position, but some people are asking about billing positions as well. But these are some of the things that you should know in general, all right, whenever you're interviewing. And you can take a look through my videos for those medical coder interview tips, but I will discuss some in this video as well. So here we go. All right. First things first. When you are interviewing, you want to make sure that you have a nice outfit. And a nice outfit does not mean jeans. That is the number one thing that you do not stroll up in there. I don't care if they're dark wash. I don't care if they don't have holes. Do not show up in jeans. Medical coding and medical billing is a professional environment. We work with doctors and surgeons and PAs and nurse practitioners and a slew of other people. How you dress and how you present yourself is going to be a big part in how people will treat you, okay? And there's plenty of programs out there. If you don't have the money to get a fancy new outfit, there's plenty of programs out there that will help you. If you're needing an outfit for interviews, there's Dress for Success, which has a location in almost every major city. And there's also your local church or, other community community outreach center that can help you guys. Just let your fingers do the walking and, try to reach out and see if, you can get yourself an outfit, okay? Because you never want to show up in jeans. Jeans is not the place for the office. And for those of you who say, oh no, I got hired in jeans, that's on you, okay? I want to set people up the most for success instantly. I don't want people to lose points for minor things, because these are what, these employers are looking at. Is it superficial? Absolutely. But we live in a society where, how you dress and how you present yourself says a lot. So you want to make sure that you are in a respectable outfit. Something that is casual workwear is fine, but you want to make sure that it is appropriate for that interview, okay? So no jeans. Number 2, no cologne, no perfume. I do not care if you say, well, this is my signature scent and this is just, it's so good, it smells so nice. No. They don't need to, you don't want to take a chance in your scent, cologne or perfume, offending the interviewer, okay? People have allergies, and sometimes people, get headaches, and it's triggered by, really strong smelling colognes or perfumes. So be respectful and don't go in there, with heavy perfume or heavy cologne. You don't want to do that because, again, you don't want to lose points just because, oh no, I can't do that with lady because that lady has such strong perfume on, I can't handle that. And for some people, it's a legitimate thing, with their headaches and everything. So you want to make sure that you are respectful. And a lot of times when you're going into these interviews, they're in hospitals or other doctors' offices. And oftentimes there's actually regulations that say you cannot have offensive perfumes or colognes on. And that's just with anything. So you want to be very mindful of those things because, you have to think about the patients first. The patient's always going to come first. And if the patient is already sick, there's nothing worse than smelling somebody who has strong perfume or strong cologne, okay? I'm just saying, you can use your cologne, your perfume at any other time, not in the interview, okay? And especially if you're going face to face. Now, if you are on Zoom or Google Meet or whatever, you want to make sure that you have a clean background, that that your camera is facing a blank wall. You don't want them to see everything that you've got going on in the back, and you want to make sure that it's not chaotic in the background, that you are in a nice quiet place so they can focus on you. All right. The whole thing with an interview is that they need to focus on you because it takes so much money. And I think sometimes y'all don't understand that it takes a lot of money to hire somebody. You have to do a background check. You have to do a tinkle test. You've got to do a lot of other things. You have to get these assessment tests administered as well. And even if they have just an assessment test that they send to everybody, they still have to grade it. So somebody has to sit here and look at the answer key and see what you wrote and see versus what the answer key says. So these things take time. Well, time is money. So when you think about all these things, it's very expensive. They are going to be very selective about who they are picking. So you want to make yourself the best candidate possible. And doing these little things shows attention to detail, okay? So that's just what I'm saying there. And you want to make sure that you are showing up with a list of questions, okay? Do not take it to chance that, oh, we're just going to be casual and whatever, or, you already self-rejecting, thinking, oh, they're just going to reject me anyway, so I'm just going to go here and just show up. Don't do that to yourselves, guys, because you never know, all right? You never know what you're walking into. But the best thing to do is be prepared. Know about the facility that you're going to. If that facility is named after somebody, you need to know who that person is. Write it down. Even if you have a little notebook, they don't expect you to memorize it off the top of your head. But at least if you have in your notes there, I know it's with, it's so-and-so who was, this person and that kind of third, whatever. So you want to make sure that you have that, because even if you write it down, you don't necessarily have to look at it, but it'll already be there in your mind with all of your questions that you're going to ask in this interview. Do show up with a pen and paper when you're asking your questions, and you have those notes on that facility. Because if I'm interviewing and I ask you, our facility is named after this person, who was this person? If you say, I don't know, that's not the right answer. And I'm like, I don't know, because this person didn't do their research. And it's the little things, again, that matter. It's the little things that are going to get you guys, right? So know where you're applying, know what that facility is known for, or how many beds do they have if it's an inpatient facility. You want to make sure that you know that kind of stuff. And that kind of stuff can be found in a simple Google search about that facility, all right? So those are the things that you want to start off with, like on your list, like the bullet points of the things that you know about that facility. Now, when they ask you, do you have any questions for us? You never say, oh no, I think we covered everything. That's the person that's not getting the call back. Not getting the call back. Because if that interviewer is, doing their job right, they're going to say, okay, that person doesn't know how to do their research. That person is not as engaged as we need them to be. Because remember, they have to invest time and money into getting you hired. So you want to make yourself the best candidate possible. So if they say to you, do you have any questions? Yes, I do, as a matter of fact, and then you bring out your list of questions. You can ask them, if you haven't already covered it, ask them about productivity, ask them about accuracy. That applies to billers and coders, okay? Ask them about those things. Ask them about how many times are you getting audited? Is it monthly? Is it quarterly? How do the audits work? Who does the auditing? Is it the supervisor? Is it the lead medical coder? Is it an outside auditor department that's doing it? Who does that? And when it comes to mediation, like when you're trying to, give your reason why you did it or why you disagree, what does that process look like? So that's something that you can ask. And that's very important, because that's something that, okay, this person they know that this is a process. Even though they're brand new, they know enough to do their research that this is what it's like for coders, okay? This is what they go through, or billers. This is what they go through, that they know they have to be audited, and we have to audit to make sure that the accuracy is there and that kind of thing. So you ask them that. You also ask them, will I be responsible for doing provider education, if they haven't already covered that? Now, before you panic, do not panic. Doctors, nurses, nurse practitioners, PAs, all of them, they are people just like you. And the longer you're in this industry and the more you work on yourself as far as your professional skills, the better off you'll get. No one expects you to do it right the first time, okay? Everybody expects you to be nervous the first time you're giving education, if that's what you have to do. But that's something that you want to show initiative. Do you have to do the education, or will somebody else do the education? And if I have a candidate that's asking me that, I'll be like, yes, this person's right on the money. Well, we have so-and-so that does the education. But if you are finding a trend in the documentation that you feel needs to be addressed, you can take it to the educator, the coding educator, and then they can take it to the providers. Me personally, I like to be the one to do the education, but sometimes it just works out better at some facilities that, one person does the education than the coders. But be prepared to do it, okay? Just don't go in there expecting to say, well, I'm brand new and, I want an entry level. No, that'll be the first person that doesn't get called, because that means you need your hand held, and no one wants to hold hands, guys. No one wants to hold hands. So you want to make sure that you are showing initiative, okay? That shows initiative. You just asked about educating providers. Okay, great. So those are the types of things that, okay, the auditing process and educating the providers. This candidate is looking real good right now. You can ask about continuing education. Are continuing education units a part of this package, this employment package? And if it is, great. How often do y'all do that? Is it every month, or is it every quarter? Are you given a stipend to pick whatever CEUs you want? Some places are like that. They don't have coding education, but they do give you a stipend so that you can go out and get your CEUs and then, do whatever, to get them. So it really all depends on that facility, but that's something that you can ask. Continuing education units, when you are credentialed, is very, very important, okay? If you're not credentialed yet, it's not a big deal, but just know that once you do get your certification, that's when the CEUs start to count. CEUs, continuing education units, do not count before you are certified, okay? So if you're racking up a bunch right now, stop it, okay? If you're not certified yet, okay? Because none of those are going to count. I'm just saying. It's just going to basically be like, okay, this person did all this education, but you're not getting credit for any of those CEUs, all right? That's just what I got to tell you on that one. So with that said, the other thing is this. So because I write resumes and I'm a professional coach and things like that for coding and, this industry health information, I get a lot of other like-minded people on my Instagram feed. And one of the things that I saw on there, and I can't remember who said it, but she worked in HR. And one of the things that she said was they had posted a picture of their kids and things like that. Well, the lady that was doing the interviewing didn't have kids. And so that person that was, the interviewee was like asking about kids, started talking about their kids. And then, then they said that they didn't want somebody who had kids to be applying for that particular position. Now, I'm not saying that this is going to happen to the coding or the billing, okay? So relax. But what I am saying is this. I'm just telling you, do not talk about your kids, your family, your home situation in this interview. Do not do it. This is not for that. This is so that you can talk about your skills. It's about you. It's not about your kids. It's not about why you're doing it or why you want to work remote or whatever. Why do you want to work remotely? Because I thrive in an environment that is quiet and that is comfortable to me. Not, oh, well, I have 3 kids at home and it's just would really help me if I had a job. No, you're the first person that's not going to get called. Why? And it's not because, because they have kids. It's not because of that. It's because they're going to feel like you're going to be distracted. So they don't need to know about your kids. They need to know about you and your skill. They need to know how much time are you going to be with them. I mean, as far as like, okay, this person is not fooling around and they're going to come in and they're going to do their work. I'm not telling this to scare y'all. There's a lot of mothers in this field, so they understand. Once you get in, but don't knock yourself out of the game because you're already here talking about your family drama and my husband this and my old lady that and that kind of thing. No. There's a lot of people who overshare. We are in a in a generation now, this whole generation, not old people, young people. It is everybody. Okay, we have social media. Social media where we share, and some people have gotten into the habit of oversharing. So here's something that I want y'all to know. Tell people things on a need to know basis. Does this person need to know? No, they do not. Do they need to know about your kids? No, they do not. You may be so proud of them. They may be doing the best in school. They may be a track star. They may be in the cheerleading team or whatever they're doing nowadays. They may be doing all of that, and that's great. But during the interview, and you're trying to get this job, that is not the time to bring them up. The time to bring them up is when, of course, when you're already in and, hey, do you have any kids and we're getting to know each other? Yeah, sure, that's fine. But in that interview, everything needs to be about your skills, the things that you have learned, and all of the experience that you're coming in with that is transferable. Everybody has transferable skills. Doesn't matter what job you came from. If you were a school teacher, if you were a Sunday school teacher, if you were working as a cashier, there's a lot of things that are transferable, okay? Cashiers, that's a lot of that is transferable is in billing. And also when you're doing cashiering, doesn't matter what you did, customer service or whatever, that can translate over into coding. Why? Because obviously when you're making deposits and when you're doing all the receipts and the books and things like that, that is secure information. You have to secure that. That's something that is translatable to both billing and the coding. So again, don't eliminate yourself from, being able to get this job because you think your skills don't transfer. They do. And there's a lot of things, especially if you had to work around people who, have a lot of ego and things like that, and you know how to de-escalate situations, you can talk about that. Oh yeah, I worked at Target for, 10 years and you don't want to go far back than that. You want to talk about the last 10 to 15 years, okay? Don't go in there, bragging all this time, okay? 10 to 15 years, that's as far back as you want to talk about in that interview. If they want to run you further back than that, they will let you know. But at the meantime, in between time, you want to focus on the last 10 to 15 years because this is the most relevant experience that you have, okay? So in the last 10 to 15 years, of course, whenever you were at Target, let's just say, for example, not an ad for Target, but, and I haven't been to Target in years, but anyway, oh yeah, I had to work in the customer service department and I had to use my de-escalation skills that I've, of course, honed since then. But I think it's a great thing to bring over to this side because I can work with just about any personality. And that's showing confidence right there, guys. You got to show confidence. Even though you don't have experience, don't harp on that. Do not harp on that. That's the thing that I see a lot of LinkedIn folks talk about. I don't have experience. I don't have experience. Stop talking about not having experience. We know. Why? Because you have like a CPCA, right? Less than 2 years of experience, you have that CPCA. All right, so fine. But what are you bringing to the table? Talk about that. Talk about not, I'm passionate, I'm this, I'm that. No. I don't want to know about that because everybody is, right? Everybody is. What skills are you bringing over? Medical terminology, anatomy, pathophysiology, of course, ICD-10-CM, CPT, HCPCS, ICD-10 PCS if you were trained in that. If you weren't, it's okay. But talk about those things, right? Talk about your favorite subject when you were in school or when you were self-studying, all right? And so that way they know that you're coding focused, or if you're learning billing and you're doing billing focused, that your focus is there. Not any other distractions, just you. No family drama, no kid drama. Oh, well, Blue, I think I should talk about that to bond with the interviewer. These interviewers are looking for the best possible candidate out there? Who is going to come in the best? Who is going to be able to mix with everybody the best? Who is going to come in here and be ready to grab the bull by the horns and do their research as they need to on their own, and then reach out when they really do need help, right? Who is going to be that candidate? Is it going to be the person who's come in here with all this perfume and cologne and almost choked us out of the room because of their scent? No, it's not going to be that person. That person's not going to get called because they know that they're hiring somebody who doesn't have that decency for other people in that interview to not wear something so heavy. Okay, is it going to be that person? No, it's not. Is it going to be the person who talked about their family drama? No, it is not. It is going to be the person who is there for business. They knew who our facility was named after. They knew what we were good for, what we were known for in our facility. They asked really deep questions that I'm impressed that they even knew to ask. They knew to ask about the audits. They knew to ask about the CEUs. They knew to ask about their workstations. They knew to ask, do we fill out any productivity reports? How does productivity reports get run? Is it run by the system? Is it run because of what we're self-reporting? You know, those are the types of things that a successful candidate that is going to get those calls is going to say, and that's what they're going to share with that interviewer. Okay. And whatever you do, you send one thank you email the next day. One thank you email. Do not sit here and follow up and every 2 days, 3 days and calling. You're going to get yourself blocked. You're going to get yourself blocked. So you want to make sure you do one follow up and you say in that email, you thank them for their time. You circle back to something that you found was a really good point in that interview, and remind them of that, you know. And then, of course, very quick, you know, maybe 1 to 2 paragraphs, but just something very quick, very simple, and right to the point. That's what they want, because that's the person that they're going to know, okay, this person's here for business. This person's not here to play around and have their hand held and want to, you know, just have everybody take care of them and baby them, because that's not what this is, guys. And again, I tell you all this so that you're prepared and so that you are ready and that you're not going to be so lost and confused, because I think that's what happens to a lot of people, is that they get lost and confused and then they get on that hamster wheel and then they start crying that nobody's hiring them. Nobody wants to give them a chance. Meanwhile, they're showing up with a 3 or 4 or 5 page resume. They're talking about their whole family life at home. They're coming in to the interview not prepared. And when you are sitting in that interview, and it doesn't matter even if you're doing a virtual interview as well, you need to be leaning in. You need to be engaged with the interviewer, not leaning back, not like, oh, you know, just all casual. No, you want to be leaned in. You want to be focused. You want to look at that person in the eye. And especially if you are doing this over Zoom, look at the lens of the camera. Do not look directly at yourself in the screen, because if you do, you see how the difference is, where I'm looking at myself in the screen versus now I'm looking at the camera lens. There's a big difference, okay? So just make sure that you know that, guys. These are very simple things. A lot of people just, you know, they're just so focused on trying to get that job, and you will get that job. And sometimes it's going to take a few interviews, and a few meaning a few hundred. And it's not to scare you. It's not to discourage you. It is to prepare you. Okay, guys, it is to prepare you. This field does not come easy. And this industry will not be the easiest to get into sometimes. I think it's very discouraging, of course, to new people. And I think that as this industry ages in this industry, right? And if we don't start bringing on new people, you know, we're going to find ourselves in a bit of a crisis if we don't watch out, right? Because we need new people to get in. But new people also need to be bringing their A game. That's what they need to do, and not just a bunch of talking. I need to see action. I need to see that they are studying. I need to know that they're studying. I need to know that they're doing their research. I need to know that they're still practicing with their workbooks. That's what I need to know. Okay, if I'm a hiring manager and I'm looking at this candidate, that's what I need to know. Okay, so work hard, keep going out there, guys. You will find it, and make sure that you are talking with the interviewer. Okay, getting to know them. And if you need to practice with somebody, practice with a friend, practice with a family member or something, on how to get relaxed to do these interviews. I do professional coaching. My rate and contact information is in the description box below. I don't have a lot of spots left this month. I'm going to be honest with y'all. But I will have a more open calendar in January. Okay. But that's just something that you all ought to know. All right. So do that. Get some of those practice skills in for the interview. Work with the mirror. Watch TED Talks. There's a lot of really good information out there, guys, to help you as well. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.